Dentists, what change to dental hygiene routines would have the most impact on preventing cavities?
Great question. That goes along with the question that we had earlier. What can we do for the bad breath? And some of the things that you do for the bad breath could be the same thing that you could be doing to prevent the cavities also. Bottom line, whatever that you are doing to prevent cavities or prevent gum disease or keep your mouth healthy, that all starts with the best oral hygiene routine. So the best oral hygiene routine, bottom line, is the brushing and the flossing. Those are the two main areas that you have to really focus on. So the common problem with the brushing, not that people don't brush. Many people, not many people, I should say, most people brush their teeth. The common problem that we have is most of the Americans, there are several studies that's been done, most of the Americans brush for an average of about 15 seconds or less.
Wow.
That's right.
That's way too short.
That's absolutely right. So that's the major problem that we have. So most of the Americans brushing about 15 seconds or less, and you can't even imagine how the quality of the job by just brushing your teeth for 15 seconds. So what you need to do is you need to brush for an average of at least 2 minutes. Mm-hmm. And a lot of these toothbrushes that you see in the market, the electric toothbrush, for example, the Sonicare or the Oral-B toothbrushes, and some of them even have these smart apps that you can put on your phone to how long you brush your teeth, and it's just kind of like, like a Weight Watchers or like the Samsung Health app or the iPhone Health app that you may have on your phone that watches your oral health. So the oral health app that you can have as well. So the bottom line, you need to brush your teeth for 2 minutes. In my case, I use a Sonicare, and I have my kids that use a Sonicare also, but I have, for my kids, for example, sometime when they don't use a Sonicare, when they're in their bathroom or when they're in the other bathrooms or whatever, they're switching bathrooms, and I got timers everywhere. The sand timers, typically you can buy them from Amazon for like $1. So you buy them from Amazon for 99 cents, and you put those timers, that's 2 minutes. So when you start brushing, put the timer on, brush for 2 minutes, and I typically say divide the mouth into 4 quadrants. One, right side top, right side bottom, left side top, left side bottom, and then 30 seconds for each. And if you want to still kind of like get into the details, 15 seconds on the outside, 15 seconds on the inside, so kind of like 30 seconds inside outside for all 4 sides, and that's the way I recommend you do it. After you finish brushing, you have to floss your teeth, because even the best toothbrush in the world, either your Sonicare or your Oral-B or any other toothbrush that you use, it's still not going to get in between the teeth. So the teeth are like this. So in between, no matter what you do, it is not going to get in between the teeth. So you have to floss in between. And then one of the major problems that I see is anytime people floss, they kind of go in and out like that. So it doesn't work that way. So you have, if you think about it, the tooth is kind of like in a round shape, and it's in a half circle shape sometimes. So you have to go underneath, and then the tooth also, not only it's kind of like, it's not flat, it kind of curves under. So whenever you floss, you have to go under and curve under, and then it's not like in and out like this. You go like that. So in and out, not in and out. So you go curve down and then come out. You curve on the opposite side, come out. Same thing you do in between all the teeth. So these are the minimum essentials that you need to have. So in addition to the brushing and flossing, what else can you do? So you can do mouthwashes, and you can do air flosses, we call them, and we have a water pick. So there are multiple tools that are available that you can use, but those are not replacement for the brushing or the flossing. But if you want to do them on the top of your regular oral hygiene routines, which are the brushing and flossing, you're absolutely welcome to do that. And this is what I tell my patients: hey, if you believe in something, then just do it, but do it on the top of the brushing and flossing that you do. But there is no shortcut for brushing or flossing, so make sure that you got a timer. And also, when patients have periodontal disease and they have a lot of bone loss, and sometimes even the brushing and flossing is just not enough, so sometimes we give them what we call it as a proxa brush that goes in between the teeth. It's kind of like a bottle brush. When you go in between, you do it like that. Or sometimes we have what we call it as a sulcus brush. We go under the sulcus. We have rubber tip stimulators to, or sometimes when we have smokers and we want to induce some stimulation along the gum line to regenerate some of the blood vessels, and we do that with the rubber stimulators. And there are multiple tools. And so talk to your dentist when you go next time, or if you have gum disease and if you have a periodontist that you're visiting, talk to your periodontist, or your best friend is your hygienist. So you're going to be spending at least like about half an hour or 45 minutes to an hour with them when you go for your next cleaning. So talk to them about the multiple tools that you could be using to help keep your teeth clean.
Yeah, there's always something you can be doing.
Yes, sir.
All right.